My name is Gurjeet Singh. I'm a senior research audiologist for Sonovo. And my favorite sound is the unadulterated laughter of my daughter. When it's a nice big belly laugh, we're certainly always trying to develop a better hearing instrument. I tend to focus in these new disparate areas. Often it's focusing on the non-technology side, so what are the experiences of those with hearing loss? And one of those that we're really excited about is this research into emotion. What are the experiences of people that have hearing impairment? What do they experience when they are listening to these signals that contain emotion information? So we looked at this, and to our surprise, we found that when you have a hearing loss, you're actually performing worse. They were less able to pick up on emotion. They found that it bothered them. They were feeling sadness. They were feeling socially excluded when they were listening to these signals. So we knew we had to do a little bit of work in this area to try to make access to these cues available. So it isn't about the personal subjective impact of hearing loss per se, but it's the emotional experience when you're listening to signals that contain that emotion information, and that's the novel twist on this project. We developed a potential questionnaire to investigate the subjective handicap that a person experiences when they listen to these signals that contain emotion information. We did a crowdsourcing study. We had almost 1,000 participants. We validated that in a laboratory study. It's called the EMO check. We have now distributed this questionnaire to a number of individuals with either normal hearing, hearing impairment but without hearing aids, and then hearing impairment with hearing aids. We have a baseline level of handicap when you have normal hearing. It's kind of in the middle. Those with hearing impairment tend to score much worse. And then to our surprise, when we ask people with hearing instruments how they do, by and large, we have seen that they're not doing any better. Well, this was really interesting for us. So we had a project that was done in Germany, and these individuals were fit with new Unitron products. And we used the EMO check questionnaire, and we thought, well, maybe there'll be this connection between some of the feature sets that are available within this Unitron device and performance on the EMO check. And this was our first study where we saw significant improvement on this subjective handicap score by these participants. So historically, we'd always had this pattern where people with hearing instruments weren't doing any better on their emotion identification or their emotion handicap scores. And in this study, which really got us excited, we saw that there was a significant benefit with Unitron devices. We're doing these activities so that we can actually improve everyday listening experiences for people with hearing impairment.